That's going to be the anterior. Behind the clavicular head is going to be the middle scalene, and then just in front of the upper trap is going to be the posterior scalene. Okay. So turn and face Sean, please. So grab the table like this. So the anterior scalene is 45 degrees of rotation. I'm using this finger here as a fulcrum to laterally flex over, so I don't get facet imbrication here. I'm going to reach across and grab the upper cervical spine, okay, and then I'm going to bend his neck over my finger. Okay? So that's anterior, middle is 30 degrees, a little less. Posterior, flip around, excuse me. I'm doing the same side, that's why I asked him to flip around. Slide over, that's probably good. Slide your butt over just a little bit to the left. So the first two, grab the front posterior. So you want to make sure you're getting some kind of tension here, okay? And now reach over, just in neutral. Okay, so that's the posterior scaling. Pec minor. Face up, please. Now, the palpations, you can either do a flat palpation like this, or you can come up like this and grab underneath the pec major. Okay. The treatment, you can do seated or supine. You want to see just one of them? Supine is fine.
Yeah.
Put your finger, your thumb like this into your pants. Okay. Slide over through.
This is why we're doing this.
Good. Now I'm going to use my forearm to stabilize his thorax. Okay, so you come in here.
I have to remember that.
Coracoid process. I'm going to make sure that the scapula is completely off the table. He's going to do this. The arm's not out like that. Well, you can do it that way, but when you do that, you're stretching the pec major also. This way, the pec major is pretty flaccid. Okay, so I like this.
I like this better too.
I like this much better because you really get pressure. Now, if I do this, I feel more of the whole chest, right?
I just feel in my shoulder joint, I feel like it's like popping.
Yeah, this is nice because it's not putting anything on the GH. Pec minor. Okay. Infra and supraspinatus, you want to see those? Yeah, please, and face me. Okay, so palpation of the supraspinatus. You come up here to the spinous scapula. You want to go up and into the supraspinous fossa. Come along and then go out towards the lateral edge is going to be the posterior medial border of the AC joint. If you want to get a little bit more, you want to get the tendon, you can lift this up like this. Okay, now slide it out underneath your finger. So there's two ways to treat this. One is from the side. You're going to grab the scapula. Supraspinatus has the word up in it, so you're going to bring his forearm up like this, so like a Popeye move, right? So just, I want you to grab my bicep here like this. Okay? Just notice I'm on the side because I'm pulling in this direction. So I'm going to pull him back first and then pull him up like that. He's going to pull away from me. Okay? So that's the supraspinatus. In the front, the rear move or the posterior move, take this hand and put it behind your back, is I'm going to have him grab my forearm, okay, or my elbow. I'm going to hold him here. Now I'm going to protract the scapula and pull straight across. Okay? That's supraspinatus. Infraspinatus has the word, starts with the letter I, so you're going to make an I with the forearm. Okay? I'm going to use my thumb along his forearm to make sure that he doesn't, if you relax, which way is your forearm fly? Right. So I'm going to put my thumb along his forearm like this. I'm going to retract and then pull straight across. That's infraspinatus in the front. In the back, put this behind your back, please. What you want to do is just use this as a fulcrum here and pull straight out.
While he's pulling back in.
And he's going to pull back in towards him, right. So again, the infraspinatus does this, right? So that's what he's doing. He's going to pull back towards him. Okay, pull. Breath in, hold it, hold it, hold it, and relax. By the way, he's pushing and pulling way too hard on that. So you got barely perceptible contraction by the patient. Okay, you okay?
Yeah.
All right. Subscapularis, lie face up, please. Okay, palpation on this is where you're going into the armpit. You want to pull the scapula off the body wall. You're going to go into the axilla I'm going up towards his cervical spine like this. I go in as far as I can and then straight down onto the bone. That's the subscapularis. When I come off the bone, it's teres minor. Then I reach space, then teres major, and then the lat. So subscapularis, I'm going to put my hand in his hand like this. I'm going to abduct and externally rotate at the same time. Push into my hand with your hand. Good. Breath in, hold it, hold it, hold it. When he relaxes, I'm going to do more abduction and more external rotation. Both. Okay? Subscap. Lat, sit up please. Turn to face the crowd. Okay, now, there's a couple ways to do this. You can use your leg as a fulcrum to bend over. So you can do this and hold him down here and do this. I like to actually get on the inferior angle of the scapula, take the slack out here, and then use this to really pull on that thoracolumbar fascia. He'll tell you that's a really good stretch. And usually the weight of his lower extremity is going to hold him down. You're not going to lift the patient right off the table. If you are, then you're stretching it too much anyway. Rhomboids. Sit at the other table, please. Put this hand on this shoulder in the front. Now relax. So I'm going to come to the superior angle of the scapula, and then I want to come down a little bit, a little inferior to that. And this is going off in this direction. So the palpation is like this. Okay, there are several ways to do this. Put this hand on my shoulder, all the way up like this. Now, I'm a tall person, and I have a long wingspan, kind of gorilla arms. So I'm able to do this with him, right? So I'm going to come up high, push down and away, and pull with this hand. Okay, that probably is going to work pretty well on him because we're about the same size, height-wise, okay? You doing this to me, it's not going to happen. So the alternative is face down, please, on your belly. Okay, so let's say we're doing this side. Put this hand in small back. Okay, I'm going to use this hand to get the superior angle of the scapula like this. I'm going to get nice and low because I'm going to push right towards Sean and Sophia's kneecaps. So I'm pushing like this, down and out. You see, I don't want to push like this. I want to push down and out like that. Okay? Sit up, please. Am I going too quickly?
No, you're fine.
Okay, turn to face the board. SCM, we could do this again another day if you want. I know we all have to go to the address. So SCM, you sort of let the head cradle like this. You reach around and you palpate the two heads. So the sternal head, what you want to do is you want to come here and look at the patient. The sternal head goes from the mastoid to the sternum. How am I going to take this away from this? By doing this. So I'm going to use my thenar eminences on his zygomatic arch, wrap my fingers around the base of his skull. I'm going to do a little bit of pronation like you're drinking tea. You can do this, okay? Or some of us drink tea that way. Okay, so, and now you're going to take your body and do the rotation. Now, he's going to turn this way when I ask you to. You can turn to the left very lightly. Good. Good. That's a little too much. Breath in, hold it, hold it, hold it, relax. I let him totally relax, I take out the slack. Now I'm going to keep going in rotation until I feel like there's no more rotation. Turn again to the left. Hold it, hold it, hold it. Breathe out and relax. Now I'm going to push straight A to P and watch what happens. You see how I get that scoop? But I'm pushing basically like that. I'm not doing this. That takes tension off. Push straight A to P. The clavicular head, you're going to have this grab, and you're doing mostly, or initially at least, you're doing COC1 lateral flexion, and then taking the slack out. And then when I go to do the scoop at the end, now he's going to push this way, so push very lightly, a little less. Breath in, hold it, hold it, and relax. He relaxes, I take out some slack. Now, let's say I don't think I can get any more. Push again. Breath in, hold it, hold it, hold it, and relax. And now notice I'm going to put my body over to the side a little bit because I want to push that way.
So you're doing straight lateral flexion? He's
Straight
pushing
lateral flexion with
after you do that
45
little
degrees.
rotation.
I'm doing 45 degrees of
It's
rotation.
like the SCM.
It's just like it's like the anterior
Yeah.
scalene, right? However, the grab is different, and you want to do less lateral flexion of the spine and more of COC1. So you really want to do this scooping like this, okay? Psoas iliacus, face up, please. So, psoas, bend this knee. Want to come in at the level of the umbilicus. You want to go lateral to the rectus abdominis, but don't go straight down because you're not going to feel anything. You feel gut. You want to go back towards the middle, right to his spine. So when you come in, right there is his psoas. Now look, watch how his hip actually flexes a little bit. If you're not sure, lift that knee up.
This one?
Yep. And there you go. Okay. So that's how you know you're on it. Okay. This is super, super, super important when you're treating low back, is to check the psoas. But a lot of people can't find it. I was at a seminar and they were like, "Oh, you can't touch the psoas." I'm like, "What planet do you live on?" I mean, you know, you can grab it. Even in people with huge bellies, you can get right in there and grab it. So make sure that you're not just going straight down, but you're going in like that, on an angle, like 45 degrees in like that. Iliacus, you're just going to come up here by the ASIS, and you're looking for trigger points in there. Treatment. Sit all at the end, please. They know how to do the standing up and lay the patient down thing, right? So I'm not going to do that. Slide all the way to the edge. Lift this knee up and lie back. Again, the most important thing here is this. See a difference here? Look. If you don't do that, you're not going to get a good stretch on it. Come to me a little bit more. Okay. Now when you look down, there should be very little, if anything, space between this buttock and the table. Okay, so very, very lightly push up towards the ceiling. Breath in, hold it, hold it, hold it, and relax. Let it hang. Good. And when he's done, up and down. Okay? Glute mid. Face down, please. Oh, fucked that up anyway. All right, so the palpation is you're going to get to the greater trochanter, PSIS, and then you're going to come about an inch off, and then you're going to kind of scan below the iliac crest in this way. Okay? Lie on this side, please. For the posterior, I'm going to push posteriorly. I'm going to bring him about 60 degrees of hip flexion. And now I'm going to push straight that way, right towards Jordan, right along his femur. Okay, so look at the line in his pants. That's the way I'm going to push. Straight back. Now, when I ask you to do it, I want you to open your hip up by pushing up like this. Okay? So, I'm going to push. Now push up very lightly. Good. Hold it steady. I'm not pushing down. I'm pushing right towards Jordan. Breath in. Hold it, hold it, hold it, and relax. He relaxes completely. And now I take up the slack by pushing straight back again. I'm not pushing down like this. Pushing straight back, he's pushing up. That's a little bit confusing when you're first learning it because you're not doing the opposite of what the patient's doing.
You don't abducting at all? I remember doing that kind of with the belt.
That's adducting him.
No, him pricking his.
Yeah, that's what he's
I thought
doing.
maybe
He's
you
doing
lift-
this.
No, I'm saying you as a doctor, you keep it in that neutral plane.
Yeah.
That's
Because as I push, watch what happens.
No,
As
no,
I
I
push his pelvis, as I push his femur into his pelvis, this is what happens. I get more adduction. That's the idea behind it, right?
And you're not really doing anything with the other hand on top.
No, just to make sure that he doesn't go whoo, sliding off the table. The red tables over in end, you know, they have that little thing cut out in the middle. That's for your pelvis. That's great for this technique because you just pop the pelvis in there and it's not going to go flying. But you know, people wear, you know, running tights or the shiny pants. They're going to go whoosh, right up the table. So you just got to holding them there. All right. The posterior, the anterior glute med. Now, how do you know which one you're on if you have a trigger point? The referral pattern. Okay.
So instead of wasting time